nurse, Nell in charge, and Leanne, and our patient. So I've knocked, I've came in the room. Can you see me okay? Okay. I've knocked, I've came in the room. My name is Leanne. I'm going to be your nurse today. Can you tell me your name and your date of birth?
Heidi Severs, May 15, 1984.
Okay, I'll check that against her wristband. Can you tell me where you are right now?
I'm at Jenny Stewart,
And can you tell me the year?
2019.
So her speech is clear. She's oriented to time, place, situation, and herself. Her mood and affect is cooperative and calm. She's following commands correctly. I am going to wash my hands and provide for privacy. Do you know what you're here for today?
For physical assessment.
Okay. So I'm just going to go through the motions with you. If you have any questions at any time, you can ask me, okay? So I would put my gloves on, and I'm going to first look at your head and feel your head, okay? So I'm going to feel for any bumps, abnormalities, any pain. Do you have any pain?
No.
Okay. So I'm going to look. There's no parasites. Her hair is evenly distributed. There's no dandruff, no abnormalities noted. And next I'm going to, her head is normocephalic also. I'm going to next go to her eyes. Alrighty. So just look at me. Okay. And her eyes constrict bilaterally. I'm going to note that her, sorry, my hands are cold. Her sclera is white, her pupils are round, and they're reactive to the light. Can you look at this and look at the wall? Okay, they're round, reactive to light, and they accommodate bilaterally. I'm also going to note there's no discharge, there's no abnormalities. Her eyelashes and eyebrows are evenly distributed, normal color, no flaking or, like I said, abnormalities. So then I'm going to look at her red reflex in her eyes. Okay, so just look at me. And we're going to do that right eye to right eye, left eye to left eye. Alright, red reflexes in both eyes bilaterally. And I'll also look at her pupils and size them, and I would say they're about between a 4 and a 5. Normal is 3 to 5. Let's see. We're gonna do her nose. I'm looking at her nose. It is symmetrical. There's no outward abnormalities to it. There's no blemishes, no bruising, anything like that. Do you have any pain when I mash on your nose?
No.
Okay, so just tilt your head up. I'm going to look at both nares, make sure they're both patent. There's no masses inside the nostrils. There's no drainage. It's not red. There is, they are moist inside. I can also see turbinates on both sides. I'm going to have you sniff, clue one side and sniff, and close your eyes. And I'm going to put something up there and you tell me what it smells like, okay?
Coffee.
And now do the other side.
Peppermint.
Alright. And then, so her sniff test was normal. She got all of those right. So next we're going to, let me see, eyes, nose. We will do the mouth next. So I'm just going to use my pen light and my tongue depressor. And I'm going to ask her, have you had any pain out of your mouth, any abnormal discharge or anything, trouble swallowing, anything like that? Okay, open up. Have you had your tonsils removed?
No.
Okay. She has normal dentition. I don't notice any caries. No breaks in the skin. Mucus is intact. It is pink and moist. I'm just going to put this in and hold your tongue down. Any pain, anything like that? Okay. Her lips are pink and moist also. So I'm going to put that here. now I'm gonna do her ears. Have you been having any pain out of your ears, anything like that?
No.
Okay. So I'm going to first palpate that external part of her ear. Any pain from your tragus or your mastoid or your pinna? Okay, I'm going to pull up and back because she's an adult. I'm going to brace myself and point towards the nose. I see the tympanic membrane. It's gray and translucent. And the cone of light is on the, it's on at 7 o'clock. So I'm going to look on the right side. And you let me know if you have any pain on anything I'm doing. Is there any pain on the external ear?
No.
I also see the tympanic membrane. It is gray and translucent, and the cone of light, since this is the right side, is going to be on at the 5 o'clock mark. Alright, so I'm going to, let's see. We'll go ahead and do the trachea. So I'm just going to get in front, palpate the trachea, know that it is midline. I'm going to come around the back and I'm going to palpate it again, and I'm also going to do the thyroid at the same time as she's swallowing to make sure that it's midline and not, I'm sorry, my hands are cold, midline and not deviated or swollen. Can you swallow for me? Okay. Any pain?
No.
Okay, awesome. So her thyroid does not feel swollen. She's not having pain or anything like that. So while I'm here, I'm going to just let you know I'm going to feel your carotid arteries in your neck one side at a time, okay? I'm going to feel that bilaterally so that I can note any abnormalities. I'm also going to listen for a bruit with the bell. No bruit. Okay. No bruit. So I'm going to palpate her lymph nodes in her neck, and I'm looking for tenderness and enlargement, things like that. So I'm going to feel for the pre-auricular, the posterior auricular, I'm sorry, my hands are cold, the tonsillar, the superficial cervical, the submandibular, the submental, and then I'm going to come back to the occipital. I can't remember. I'm going to go back up to superficial cervical in case I didn't hit it, and the deep cervical chain. And then supraclavicular is here, and infraclavicular is right below the clavicle. Okay? Are you having any pain or discomfort?
No.
Okay, awesome. Now, so next I'm going to do the upper extremities. I'm going to check the lymph nodes of the upper extremities first. So I'm just going to unbutton a little bit, and I would check these bilaterally. So first I'm going to note the temperature is warm, the skin is dry and intact. So first what I'm going to do is I'm going to feel back here around the scapula, and I'm going to try to palpate the suprascapular lymph nodes just around the edge of the scapula. And then I'm going to do the lateral on the arm. I'm not palpating anything, nothing's enlarged, she's not having any discomfort. And then I would go into the deep, which is deep inside the armpit or the axilla. I don't feel anything. Are you having any pain?
No.
Okay, awesome. So I'm just going to come down. I'm going to feel the muscles and just kind of know, Can you push down on my arm? The strength on the muscles, it's 5. I'm gonna palpate the brachial pulse. I'm gonna palpate the radial pulse. I would do that bilaterally. I'm going to have her, can you extend your shoulder? Is there any pain there?
No.
Alright, I'm gonna feel for any crepitus. Can you flex your elbow? Any pain?
No.
No crepitus. And can you flex your wrist? And can you move it side to side? Okay, extend your fingers and put them down. I'm gonna note the nail curvature is, I mean, I guess it's supposed to be that. It's normal curvature of the nail. Capri feels less than 3 seconds. Can you grip my fingers? Okay, so her hand grip is normal. I would check that bilaterally. Like I said, I would check temperature, hair distribution, and everything bilaterally, as well as color, just to make sure that she's getting the right circulation in both her arms. And then let me see. I don't know if I said I would rate the the muscular strength as a 5 on the scale. Let's see. So I think that's it for upper arm. So now we're gonna move down to chest. I'm gonna go around the back. Okay. And I'm just going to percuss by placing my hand and tapping with my fingers in the 10 areas. You're gonna note tympani over the lungs and dullness over any of the solid organs. And then I'm also gonna note, I'm gonna put my hands here and ask her, can you take a deep breath? Okay. And she has symmetrical breaths. Hold on just a second.
Sorry, that was fine.
No, you're fine. She has symmetrical breaths. There's no overextension of the chest cavity posteriorly. And I would note that she's not barrel chested. Her chest is a 1-to-2 ratio, which is normal. That's what we expect for somebody that doesn't have any respiratory issues. And I'm now going to listen. So when I listen to you, just take a few deep breaths, okay? I'm going to listen in all 10 areas and note the lung sounds posterior in all 5 lobes. I don't hear any adventitious lung sounds. And I'm also, while I'm back here, I'm just going to look at her spine, check the cervical spine, make sure it's aligned with her thoracic spine and lumbar spine. No pain when I touch it. Okay, awesome. And then I did the AP ratio right. Okay. And then, let's see. Oh, I forgot one thing. So while I'm back here, I'm going to check for the costovertebral angle tenderness, and the way that I'm going to do that is just by lightly tapping with my fist. You have any tenderness? Okay, awesome. Okay. Alrighty, so I'm basically going to do the same thing up here. I'm just going to tap on you and then I'll listen to you, okay? I think I'll listen then tap. No adventitious consonants. And again, you're just looking for timpani over the airfield areas and dullness over the solid. I'm sorry.
It's okay.
Alrighty, so like I said, over her lung field you're gonna hear timpani, and over the actual organs you're gonna hear dullness because they're just solid masses. And now I'm going to listen to her heart. I'm gonna listen to your heart, and I'm gonna do that with the bell and the diaphragm. So the second right intercostal space is aortic. The second left intercostal space is pulmonic. Erb's point is the third intercostal space. You have a strong heartbeat. Tricuspid is the second, I think it's midclavicular. And then mitral, I'm sorry.
No, you're friendly.
She's not afraid to just knock some stuff out of the way, is she?
I'm not. And then mitral is going to be the fifth intercostal space, midclavicular line. And I'm going to listen to the aorta or the apical pulse for a minute. And this is also the point of maximum impulse. Which you should be also able to palpate. Apical pulse 64 is good and strong. So let's see. I also did not notice any lifts, heaves, or thrills while I was listening to it. I don't notice any abnormalities when I'm looking at her skin of her chest. She's a little broke out, but that may be nerves. Other than that, her skin is evenly, it's evenly colored. All of her skin is a uniform color. There's no abrasions or bruises or discolorations. So I'm going to have you lie down. Do you want me to raise the head up a little bit? And there's a blanket here. Do you want to just use that to grab a hold?
Sure. You leave like
Right. You want me to raise the head up? Yeah, sure.
should be good.
That's good?
Yeah.
Okay. So I'm gonna have her just bend her knees just a little bit so we get some pressure off the abdomen. And I'm gonna come around so that you guys can see. So I'm going to start by inspecting her abdomen I would lay her flat. I'm gonna lay you flat for just a second, okay?
Yeah.
Of course, it's not working on this side. Welcome to our lives. I'm gonna note that her abdomen is flat. It's not distended. Before I do anything, I just want to look at it and notice if I have any pulsations going on or anything that would be out of the ordinary. If that was the case, I would not touch it. I would try to investigate and see what was going on. So now that that's settled, I'm going to listen to her 4 quadrants. I'm going to start in the lower right quadrant. Normoactive. 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 And normoactive. So while she's laying flat, I'm going to take this opportunity to also listen for her aorta. You can palpate it in some people you can't. So I'm going to listen to it with my diaphragm and my bell. Just so that I can tell if there's any bruise or anything going on. I'm also going to listen to the renal arteries. And the femoral arteries, just to see if I have a bruise. And I do not. So now that I've inspected and I've auscultated, I'm going to start with light palpation. Are you okay?
Yeah.
Alrighty. So I'm just gonna go lightly. I don't feel any masses or abnormalities. Are you having any pain? Okay. Now I'm gonna go a little deeper. You let me know if you're hurting or anything, okay? Any pain? I didn't feel anything abnormal. There's no solid masses or anything in there, nothing swollen. Her abdomen is soft, non-distended, and I'm going to test for rebound tenderness. So I'm just gonna push straight down and pull up quickly. Did you have any pain?
No.
Okay, so she's negative for rebound tenderness. Let's see. And then I can percuss over her abdomen as well. So what we expect to hear is dullness, because those are the intestines and there's usually stuff in there all the time. So, let's see. Can you raise your head for me? I would probably do this without a shirt on so that I could see any bulges, check for a hernia, or the diastasis recti. Which is, the separating of the muscles, which happens sometimes after you have kids. So I'm going to raise your head up a little bit so that we can get up. Alright. Sorry. Alright. So right now I'm just going to watch her walk and I'm going to notate her gait. She has a steady, normal gait. She's not having any abnormalities walking. How do you get around at home? Do you have a wheelchair or any assistive devices? Okay, so her mobility is normal at home. And let's see, while you're standing, can you extend your hip? Just push it straight out. There you go. And back behind you. And can you bring your knee up, flex your knee? And can you dorsiflex your foot and plantar flex it and then rotate it around? And can you fan your toes out? And I would check that bilaterally and notate range of motion, whether it be full, which it was in this leg, or if it was limited, I would rate that on a scale. Let's see. I want to note that her feet and her legs are normal, evenly colored. There's no hair, but I'm sure it would be evenly distributed if there were. So you can just have a seat for just a second. Let's see. So I've done upper extremities, we've done chest, we've done the back, we've done the abdomen. So we'll just continue with the legs. Okay. So, like I said, everything looks fine. I'm going to have her bend her knees, and while she's doing it, I'm going to notate any grinding or anything of the bones. And then I'm just going to move her. Can you push my hand? Push my hand. Pull back. Pull back. I would rate her muscle strength as a 5 in both legs. Capillary refill is 3 to 5 seconds in her toes. The temperature and skin is, like I said, warm, dry, intact on both legs. Let's see. I'm going to test the dorsalis pedis pulse, and it's +2. I'm also going to do the posterior tibialis. I would do that bilaterally. Dorsalis pedis. That's all +2. And then, okay, so now I will do, so I'm going to do the deep tendon reflexes. I'm going to start with the arm. And I'm going to do the brachial. Just relax your arm. I'm going to do that. Alright. And then I'm going to, sorry. Alright, I'm going to relax. And then you're just looking for the muscle to kind of jump, and it did. And then I would do that bilaterally. And then next, we're going to do the knee. You might have to scoot back because your legs have to be. You're just feeling for this bottom little groove down here. And then, there you go. And then you can also do the Achilles. And you just want to make sure that the foot jerks. And like I said, I would do that bilaterally on both hands, both arms and both legs. One thing that I did forget was the Weber and Wren test on her ears. So I'm going to real quick, and then I'll do the whisper test. I'm going to do this, and I want you to tell me when you don't hear it anymore, okay?
No.
And then I'm also going to do it on the master muscle. Okay. And then I'm also going to do it on the top of the head. Can you feel it all?
No.
Because you're touching.
Oh. Can you feel it now? Okay. Now I'm going to whisper, and I'm going to get behind you, and I'm going to clue one of your ears and whisper something. You just repeat it, okay?
Baseball. Clowns.
And then, so that was all normal. So now I'm going to have you close your eyes and hold your hands out. I'm going to place, palms up, sorry. And we're also going to test for pronation and supination. So, there you go. I'm going to place 2 objects in your hands, one at a time, and you just tell me what you feel, okay?
And that's a key.
Okay.
And this one is a clown.
Okay. And that is stereognosis. And now I'm going to do, it's called graphesthesia. I'm going to put a letter or a number in your hand, and you tell me what it is, okay?
3. 8.
Okay, awesome. So you pass both of those. And then, let's see what else I see. So, oh, you know what? I didn't even let her bring it up for sure. Okay, so I did forget to do the cranial nerve, so we're gonna do those real quick. Okay, so I did do 8, which is the auditory nerve with the tuning fork. The first nerve would be olfactory, which is the nose, and we did do the sniff test on that. So her smelling is fine. And then 2 is the eyes. So we're gonna do the 6 cardinal fields. No, that's 3, 4, and 6. 2 is direct.
Confrontational.
So we're gonna test right now, and we're gonna do the 6 cardinal fields of gaze. So you just look at this pen. Don't move your head. Just move your eyes. Okay, and then we're gonna watch for lateral gaze. So just hold your eyes there. Okay, good. And now come this way. Okay. And like I said, that was 3, 4, and 6. 7 is the. No, I need to do 5. I think 5 is the trigeminal. So I'm going to test. 5 is trigeminal. And for that, I'm going to have her clench her teeth, and I'm going to feel her TMJ and make sure there's no problems with that. There's no grinding of the bone or anything. I can feel her muscles moving. Are you having any pain? Okay, awesome. And so we're going to do 7, which is facial, and I'm going to have her blow your cheeks out. And what do you call it? Make your eyebrows go up. What do you call it?
I don't know.
Raise your
I
eyebrows.
was about to say shrug your eyebrows, but yeah, raise your eyebrows. Sorry. And then have you smile and frown. Scowl. Okay. And then I'm going to actually take a Q-tip, and I'm gonna have you close your eyes, and you tell me if you feel something soft or something sharp, okay?
Soft. Sharp. Sharp.
Okay. It's hard to tell sometimes.
Yeah, it is.
Okay. Alrighty. And actually, while I have that out, I'm going to do it on her hands.
Sharp.
Hold on.
Again. A doll.
Okay. And on her legs.
Sharp. Doll.
Okay. So that is intact. And then, so we got to 7, and we did 8. 9 and 10 is the swallow and gag reflex. So we tested gag reflex a little earlier when we did her thyroid test, but I'm gonna have her sip again while I'm up here up front so that I can watch. Are you having any problems? Okay, and she's not gagging when she's swallowing, so that's intact. And then 11 is, can you shrug your shoulders for me? And turn your head. And turn your head. And that's all intact. And then 12 is the last cranial nerve, and that's hypoglossal. And so can you stick your tongue out and move it side to side? And there's no pain, and there's no visible swelling. So her cranial nerves are all intact. And give me 1 second. I'm going to look at my paper real quick. I do know I'm going to have her bend over so I can check for scoliosis. Okay, so scoliosis, Babinski, and final. Okay, so while you're sitting there, I'm gonna have you do 2 fine motor tests. I want you to pat your hands as fast as you can. Okay, that's intact. And then do your fingers, the thumbs to the fingers, that's also intact. I'm going to have you stand up real quick. I want you to bend at the hips, straight over well, we might want to do it this way. There we go. Bend at the hips and dangle your arms just below you. There you go. So I'm just gonna run my fingers down the spine, make sure it's midline, and there's no pain when I'm doing this.
No.
Okay, and then you can stand back up. I'm going to notate her shoulders, make sure that they're symmetrical, one's not higher than the other because that could indicate that there's a spinal problem. And you know, I could just feel the hips, make sure everything's in line the way it's supposed to be, and everything's fine. Can you twist your body? I'm just going to check range of motion of the spinal processes and bend from side to side. And she bent forward fine, so her spine is intact. And then just have a seat for me. I'm going to test her plantar or Babinski reflex, and that's just by going from the heel of the foot
I'm ticklish.
up towards the great toe. In an infant, the toes, they fan, don't they?
Yeah.
Okay.
Ours is supposed to go.
Yeah, in an adult, the toes are supposed to curl, but in an infant, they fan out. So that can tell you if it's abnormal or not. Or you could do that if you're ticklish. Let me see. Okay, so last but not least, I almost forgot. So last but not least, I'm going to see if I can take her over to the Snellen chart. It's approximately 20 feet away, and we will see what her eyes rate on that scale. So I'm going to have her come over here. I'm going to give you a little index card, and I'm going to have you cover one eye at a time, and tell me, I'm going to point to a line, you tell me if you think you can read it. Or should I go down or up?
FEOFD?
No.
LPED.
Yes. Alright, switch to the other eye.
I'm blind. Let's see. I can go down some more. Down. And down one more. DEFPOTEC.
That's pretty close. You're on this one.
Alright.
Alrighty. So in one eye you have 20/20, and in the other eye you have 30/30.
Okay.
Yes. Alrighty. So we will get you some glasses. And do you have any questions?
No.
Okay. I think that is it.
I'm gonna stop now.
Yes.